see my screen right now, I show a table that shows some of our performance data, and it also kind of gives some insights to the reader on which vendors have standalone solutions. And if you look at that, those vendors who have a green dot in the column for sell as a standalone solution are the ones that you're going to want to look at first. So you can see on that list we've got GE, QuadraMed, Allscripts, McKesson, as well as Siemens Sorian, who all sell their patient accounting solutions as standalone solutions. Certainly we can, as the discussion goes further, we can talk a little bit more in depth about some of the different options that you have there. In terms of those who are selling what I would consider to be a next generation standalone solution, really there's only one vendor out there that I'm aware of that's currently selling a next generation solution, and that would be Siemens Sorian. So Sorian does have a newer product. It's been designed more recently for some of the issues that folks have today. That said, as many of you probably are well aware of, that's been in process and they've been working on that for the last several years. McKesson actually was building a next generation solution that they decided to shelve in favor for their Paragon solution, which was they called it their Horizon Enterprise Revenue Management product. In addition to that, you should also be aware that Allscripts has a new product that while there are no live sites that I'm aware of yet, they should be going live with their first site in the next probably 2 or 3 months. That is a next generation solution. In other words, it's been built from the ground up over the past few years, and it's been designed for more recent challenges and some of the more recent needs that we see in the revenue cycle market segment.
Okay. Well, I think that sparked another question from one of our participants. We obviously have talked about best of breed. Who has an integrated inpatient EMR and billing system?
Well, I'll tell you what, that's becoming a hot topic for us right now. Many providers out there that are looking at patient accounting solutions really would like to have integration between their inpatient EMR and their inpatient billing systems. They'd also really like to many are starting to ask us questions about integration between their inpatient billing system and their practice management solutions. And so really as we put together this research, we tried to focus on addressing that, at least helping provide some insights into what options out there are integrated. We certainly see some vendors out there that do a nice job with interfacing work, but I would have to say that from my vantage point, there certainly is a list of those. And again, if I could refer you back to the table that we have on the first page of the report, my intent here was to try to help provide some quick, easy references for you to identify who has integration, the levels of integration that you're looking for. Of all the vendors that we watch right now, I would have to say that Epic probably has the greatest amount of integration. So they have certainly integration between their inpatient EMR and their billing system. They also have integration between their practice management solution and their inpatient billing system. Cerner also, by the way, has the same type of integration. The big difference between Cerner and Epic is that Cerner, while they have an integrated solution between their inpatient billing and their outpatient billing systems, they've had they're new. So we don't see a lot of sites. We've only been able to validate really just 1 or 2 sites over 200 beds that actually have integration between their inpatient billing and outpatient billing systems. That said, certainly there are a lot of options. There's a couple of other options for vendors who have integration between their inpatient and outpatient billing systems. GE and Siemens would be the other 2 that have that capability. And then we see certainly with Meditech and Cerner, as well as with McKesson, that they have some integration between their inpatient EMR and their inpatient billing systems.
Great. Now, looks like we just had a couple of people join, and we just wanted to remind those on the line that you're welcome to ask questions. If you'd like to chat with us live, you actually can do that by raising your hand, or you can use the chat or question panels to type those questions in as well, and we can address those. So please don't be shy about asking your questions. Now, Mike, we've got another question regarding integration, and this is regarding inpatient and outpatient billing systems. Specifically, who has integration between those systems, or the question better posed, who doesn't have integration between their inpatient and outpatient billing systems?
Yeah, so we kind of talked a little bit about that just a second ago, but and certainly we can talk a little bit more in depth about that. But certainly, it's interesting, Graham, that that question is posed, because what we're starting to see in the industry right now is a little bit of a shift in the way people are looking at solutions. Historically, in the past, and I've been at class for about 10 years now, but historically, a lot of people were looking at, first of all, billing system as its own solution. Then they started looking at integration between their inpatient EMR and their billing system. And now we're certainly starting to see a lot of people now taking a holistic look at the entire enterprise. And so as they start looking at a vendor that may make sense for them, they're really trying to understand how do all of the pieces of the puzzle fit together, how are they going to handle all the clinical aspects of this, as well as how are they going to handle the revenue cycle pieces. So with that said, obviously there are some options out there for you if you're looking for integration between your inpatient billing system and your outpatient billing system. I think I already touched on a few of those. Those who don't provide those options right now, from our vantage point, would certainly be, as you can see, would be QuadraMed and Allscripts. We also have Paragon and Meditech. So those would be the four vendors that don't currently have integration of the main vendors that we're certainly tracking that don't have integration between their inpatient billing and their outpatient billing solutions. That said, I know that Meditech certainly has made some significant investments in their LSS product, and certainly I would anticipate over time that that's going to become more tightly integrated. Paragon is developing. Certainly they're developing an outpatient solution. I think they're focusing right now on more of their EMR capabilities, but I would anticipate over time that you'll see them trying to develop some integration points between their outpatient solution as it becomes available. Certainly Allscripts has a probably one of the biggest install bases in the ambulatory setting. They have got a lot of clients out there. That's been one of the challenges that Allscripts has had is really being able to tie their outpatient products more tightly with their Sunrise solutions that they have on the inpatient side.
Okay. Let me put a little context around this next question. Now, obviously, with meaningful use activity going on, the mighty carrot out there stimulating a lot of activity in the EMR market, are we seeing growth in the patient accounting sector? Why is that? And the real question here is, who seems to be experiencing the most growth regarding their patient accounting?
Yeah, again, that's a good question. One of the things that we're watching right now in the market, so we started to do some research back in 2008 that indicated, and I think I mentioned this on the webinar, that provided some insights that and some indications that there was going to be growth on the revenue cycle side of the fence. We certainly started getting more questions asked for us in 2008, and then we certainly saw the recession kick in. People's budgets started to tighten, and then all of a sudden, early 2009, we had the High-Tech Act that's signed by President Obama. And so all the focus was diverted from revenue cycle over to really investment in meaningful use and certainly investment on the clinical side. What we're starting to see now is we're actually starting to see more questions coming back around to revenue cycle, and the reason for that are wide. There's a lot of different reasons why people are looking at that. First and foremost, these technologies are pretty old. So some of you, I suspect, have probably been on the systems that you're on for the last 20 years. And with that old technology is now you're starting to try to think about how you handle bundled payments and how you really start to prepare yourself for an accountable care environment. You're probably wanting to look at what are your options out there and how can you best accommodate those options. So we are starting to see growth, as you guys could see. In fact, let me just scroll down a little bit. I'm on our microsite right now, but let me just show you this chart, and you can't see this very well, so I apologize. But in essence, we are seeing certainly a lot more activity right now with providers looking at some of our technology or looking at our patient accounting market segment. In fact, the number of hits that we're actually starting to see right now, it's increased by almost 200%, and certainly Siemens Sorian has the most hits that we're seeing right now in the marketplace. But Cerner is certainly getting a lot of activity, as are most of the major vendors in this space. And so certainly we're definitely seeing some growth there.
Great. You know, you mentioned the High Tech Act a minute ago. Why has nobody coined the phrase Obama share? Can I do that right now? Can I get credit for that right now? Live? Start sharing that with your friends. Let's get that out in the industry. Obama share. I love it.
Thank
you. We actually have another question in from one of our providers who's listening today. What are your thoughts, Mike, on the stability of the vendors in the revenue cycle market going forward?
Craig, thank you for that question. So on the stability of those vendors in the revenue cycle market going forward, you know what? It's interesting because you know, certainly we're seeing on the clinical side, we're seeing a couple of vendors that are having some really good success and gaining some strong momentum, and that would be Epic and Cerner. Certainly with our clinical market share research, they have a lot of wins. With a lot of the Epic wins, they're pulling through a lot of success with revenue cycle solutions as well. So a lot of their new clients that sign up are signing up for both their clinical and their financial systems. Cerner, not as much. So Cerner, while we are seeing them start to gain some momentum and grow a little bit on the revenue cycle side, Cerner has not had quite as, their patient accounting solution hasn't been as stable. It is getting better. We're certainly seeing improvements, but historically, because of some of the challenges they've had, it doesn't have the same level of traction that we're seeing on the Epic side of the fence. With GE, it's been interesting for us to watch GE because GE appears to really be putting a lot of resources and effort behind their revenue cycle solutions. And so as I mentioned earlier, they do have, I just had a call this morning, by the way, with a director of revenue cycle who has purchased earlier this year the Centricity Business Hospital Solution and Ambulatory Solution that's scheduled to go live mid-next year. And from their vantage point, it's been a very positive experience, and GE appears to really be very intent on making this successful and working well. So they certainly do appear to be making some investments. QuadraMed, I'll be honest with you, I'm not quite sure what to say with QuadraMed. QuadraMed's been around for a long time. We're not seeing much growth with QuadraMed on the clinical side, and frankly, we're not seeing a whole lot of growth with them on the revenue cycle side. I do know that it's an important area for them, but frankly, I'm not seeing a lot of net new growth. With Allscripts, Allscripts obviously has got a lot of customers that have been on their old legacy system. I think the one thing that I would say that's, so there's some questions around Allscripts. They've had some changes in their leadership, and frankly have been it seemed like they've been a little bit distracted at times because of some of the organizational changes that they've experienced. But Allscripts has also made some pretty significant investments in this next generation solution. Unfortunately, I just don't have a lot of data points to share with you how well they're performing yet with that new solution set. But certainly the fact that they are going to be going live in the next couple of months, we think, with one client, would indicate to me that they are certainly making investments in that area. Paragon becomes a really interesting one because Paragon historically has not been sold as a standalone solution. Generally, when people buy a McKesson Paragon solution, at least what we're seeing in the marketplace right now, they're purchasing the entire thing, right? And so, in fact, frankly, if you want to buy Paragon's clinicals, you have to purchase their financial package as well. That said, you can buy them as a standalone. We have seen a few instances where people have. I think the question mark around Paragon is that it's not been used typically in the larger organizations, and so some people want to understand, what its ability to scale is. Its feature functionality isn't quite as rich as we see with some of the other products out there. As you guys know, with Siemens has been a major player in patient accounting for a long time. Again, they're having some nice growth. They're also having some challenges, and so Sorian has unfortunately had some of the lowest scores. In fact, they came in last place as in this particular body of research. And part of that's attributed to the growth that they've experienced. Part of that, frankly, is attributed to a lack of maturity of their product and their capabilities. Craig, I hope that's helpful for you. Certainly, if you have some specific vendors that you want me to elaborate on, please let me know.
Great. Now we've got about 10 minutes remaining in our QA today, and I just wanted to remind you that you're welcome to ask specific questions relating to this market segment of Mike today. Please don't be shy. We won't judge. We won't judge any of your questions. Mike, obviously our listeners probably have had some exposure to the report. I doubt to the level of detail that you obviously have dug into this. While we're waiting for some specific questions, why don't you just give us a brief overview of some of the major takeaways from the report?
Yeah, so I mean, some of these things we've already touched on, so I certainly don't want to take up too much time talking about some of the things that we've already touched on. I guess from my vantage point, certainly I would say that there is increasing interest in revenue cycle. One of the things that I've seen in some of my recent calls, I know a lot of people right now are probably hesitant to make any major changes because of ICD-10. You guys are all aware, I'm sure, of the date that's coming up. The switch over from ICD-9 to ICD-10 is October of 2014. So we're seeing a lot of people that are cautious to make any changes on their systems at this point. They just want to make sure that they're ready for the ICD-10 transition. That said, what I'm seeing is I am also seeing some providers out there that are trying to get in the queue. They're trying to make decisions now so that when that event happens, that they're able to move forward and quickly make a change to their system. And so just be aware that there are certainly a number of folks that, while they may not be moving on it right this instance, they are trying to get in the queue so that they can get what I would consider to be almost like the A-team for the implementations and be able to move fairly quickly with their implementations.
Perhaps you can give providers kind of a preview of coming attractions of some of the things that class is going to be working on related to the revenue cycle process, patient accounting, and even maybe some of the other regulations like ICD-10 and things related to that are coming up as well.
Yeah, so obviously there's a lot of things that are coming up right now, and one of the things that we're trying to focus on for future research, we actually are planning to do and are in an early, just at the very, very beginning phases, discovery phase of research around accountable care, and really understanding some of the different payment methods that are going to occur there. Bundled payments is certainly going to be part of that effort and that initiative. So you're going to see us start to look at that very, very closely. In addition to that, you should also be aware that we're going to be publishing shortly some research around patient access. And so patient access is becoming for whatever reason, more focus is now starting to shift onto the front end of the revenue cycle process. And we're starting to see some trends that would indicate that some people are starting to move towards having an enterprise vendor for their solution. So we're watching closely to look at the Passports of the world and to look at certainly McKesson's Relay Health's solution set to see if there is some movement, in fact, moving in that direction, where a vendor or a provider is actually now going to standardize with a single vendor for most of their patient access functions. We certainly anticipate that's going to experience some growth. In addition to that, you guys should just be aware that we're also anticipating that we're going to be seeing more growth on the revenue cycle outsourcing front. I just had a call yesterday with a vice president of revenue cycle who has actually outsourced part of their back office to Accretive Health. Some of the drivers behind that is that they're trying to cut costs, and they didn't outsource everything. They outsourced some management layers, and they outsourced a bunch of tools and technology. But certainly be aware that we're going to be looking closely at that. In fact, we'll be publishing some research probably in the next 3 or 4 months around revenue cycle outsourcing.
Great. We have a question coming in regarding bolt-on systems. Obviously, providers expressed the observation that a lot of providers out there are using old homegrown or highly modified vended systems. What are your thoughts on bolt-on needs with the new generation and integrated systems on the market?
Craig, that's another good question. I mean, obviously, the goal for a next-generation solution is to hopefully eliminate, most or all of the bolt-on technologies. I don't know that I can give you a perspective yet on Allscripts because they don't have any life science. I know from a Saurian perspective, Saurian does does indicate that they can eliminate most or all of the bolt-ons. We certainly have found that they have been able to eliminate some of them. I'm not quite sure why some of their clients do continue to use bolt-ons, perhaps for preference reasons or functionality. But I don't know that I've seen too many instances where they've actually have truly eliminated all of the bolt-ons. But certainly have been successful in eliminating a number of the bolt-on technologies. On the Epic front, we also see that there are some players like MedAssets excuse me, I think that's on the Cerner front, where a lot of clients will use Cerner along with MedAssets bolt-on technology. We've also seen, I just had a call with a Vice President of Revenue Cycle who is implementing Epic's revenue cycle, but is still planning to use some functionality from MedAssets. That said, their intended goal, their stated goal to me, was that they believe that they should hopefully be able to replace most of the bolt-on technologies, and as Epic has that type of functionality, they probably will. Certainly I know where you're trying to go with this, Greg, and hopefully be able to eliminate that. The other option you may want to at least consider, or at least that we're seeing some consider, as I mentioned earlier, is some are actually looking to standardize on a single vendor for all of their bolt-ons on the back end or all of their bolt-ons on the front end. And so we're watching that market quite closely because I think it is going to take time. A lot of these vendors, frankly, are focused on a lot of other initiatives right now because of meaningful use and because of ICD-10 and because of accountable care. And so it's going to take some of them, some of the core vendors, probably some time to address some of those issues.
I think we have time for one or two more quick questions. In the interest of saving time, if you'd just like to use the raise your hand feature and you're not too shy about jumping on the line with us here, we'd be happy to answer those questions live.
This has been helpful. This is an exciting space. As I mentioned, we're doing a lot of things. There's a lot of stuff coming at you guys right now, and we certainly are mindful of that. You know, in my conversation earlier today, it was interesting because this VP of Revenue, or excuse me, Director of Revenue Cycle, took a minute to talk a little bit about what they're doing on the CAC front. And computer-assisted coding is another area that we're really starting to invest time and effort behind. In this particular instance, with this organization, it was a children's hospital. They've just purchased 3M's CAC solution. And have indicated that they hope to be live on that product by January of next year. That said, a little bit nervous because that doesn't give them a whole lot of time to test it out, and quite frankly, they feel like they need to rush a little bit for that. The other thing that they're looking at closely is clinical documentation improvement, and so certainly that's another topic that that some of these folks in the revenue cycle areas are trying to get their arms around. Is how do we ensure that our physicians are documenting at the level of specificity that we need for this transition to ICD-10. So that's certainly another area that we're going to be looking at and focusing on fairly closely. A couple of the things that I just wanted to mention to you guys is that another body of research that's going to be coming up is we are actually doing some perception research. It's in process right now. It'll probably come out early next year. But again, we're really trying to watch closely to see what are the standalone solutions that people are purchasing. Obviously, we can see in our own data that Soaring is getting some nice action on that front. We're certainly seeing just a little bit of movement right now with this call I just referenced with GE. But we certainly do anticipate over the coming months to be able to share with you guys really a sense of what vendors people are looking at closely. And considering, strongly considering for a purchase.
Well, great. Thanks so much, Mike, for taking the time to do this. Looks like we've come to the end of our time here, but we just wanted to encourage you that if you do think of some questions after today's broadcast, if it's just sparked some questions you'd like to follow up with, you're welcome to contact Mike or your class representative, and we'd be happy to be able to answer those. We'd like to thank Mike for taking the time to answer the questions today and those who participated. If you'd like a copy of today's report or any class data, you can actually contact your class representative, or you can visit our website at classresearch.com.